Hi, I'm Dr. Raymond Douglas of Beverly Hills, California, and today I'd like to go through some patient stories. We have several on our website that document a patient's journey through thyroid eye disease, and many of them are documented in this book, which we give out to patients when they request a consultation. And today I'd like to highlight what really happens during thyroid eye disease and the effects that can occur. And so for this patient, she had a job where she had to deal with her hand-eye coordination quite a bit, and she developed thyroid eye disease. And as you can tell, her eyes began to bulge, they began to open abnormally, and they became very painful in addition to having double vision. So a job where you normally have to have mechanical skills and hand-eye coordination became almost impossible to do. In addition, you can imagine someone who's an avid biker trying to bike with this condition or cycle along the country roads, and that no longer became an option. And you can also imagine how going out socially became very difficult because people at a grocery store or even young kids innocently would say, "Mommy, what's wrong with her eyes?" And these are all the things that people with thyroid eye disease face in this journey. And one of the things that I strive to do is develop a customized approach to both restore the appearance and the function. And for this particular woman's case, the one thing that we wanted to do would be to move the eyes back with a customized decompression. And she achieved about a 6 millimeter decompression. These types of decompressions can be done in an overnight, without an overnight stay. Come in, go home the same day. Both eyes can be done at the same time, and no noticeable skin incisions to see. So in the period of a couple hours, we can move the eyes back quite a bit and take the first step. At the same time, often we can lower the upper eyelids. And this is really important because it at least takes the first step and reduces this multiple surgical process down into 1 or 2 surgeries. And by working on the eyelids at the same time, both the upper and the lower, we can again speed the recovery process along and requiring fewer surgeries. So by moving both eyes back and lowering the upper eyelids, you can see how you can achieve a really nice result. Often the lower eyelid is also in an abnormal position. It's not here, but we can also adjust that if needed at the same time. Typically, correction of double vision has to be done as a separate surgery. And decompression can lead potentially to double vision even if you don't have it going in. On average, I've looked at my last few hundred cases, and it appears that there's anywhere from about a 1 to 6% chance of having double vision after having a decompression, depending upon how large your muscles were before the surgery. And that's something that we discussed in depth during the consultation. But not only does she look better, the function was tremendous. And I get so many hugs every time I see her because what happened after surgery is even more important than what she looked like or happened during surgery. She went back to her job, which was one thing, and enjoyed it and could do it. But within 6 months, she had entered a triathlon and competed and finished it all after having this surgery. And because she could see, her eyes weren't bothering her, and she could both swim, bike, and run. And so it really was a testament to how you can restore someone's life even with a surgical correction, and not only just socially but also the function, and restoring function and improving the comfort of the eyes, less double vision, and just getting back to life again. We always say it's be you again, but it really is. It's trying to get back to that life that thyroid eye disease kind of took away. If you have any questions about this segment, please leave your comments below.